So, hello students. Our today's topic is diseases of artery. So, here we're first going to discuss is the arterial stenosis. So, what is arterial stenosis? The arterial stenosis it refers to the narrowing of an artery. So, the narrowing of the artery, that if the artery gets narrow up, what will occur? That will slow down the blood flow to various organs and tissue in the body. So that is term we donate is arterial stenosis. So how does this arterial stenosis occur? It can occur due to build of plaque. So there is buildup of plaque on the inner wall of artery. The term we use is atherosclerosis. Now, why do this atherosclerosis occur? It occurs due to result of unhealthy lifestyle habits like smoking, a diet consisting of saturated fat, and a lack of physical exercise. Other causes of arterial stenosis could be inflammation, injury, or genetic factor. So, if this arterial stenosis it is left untreated, it can lead to complication like heart attack, stroke, or limb ischemia. That means inadequate blood supply to the limbs. So remember, in the lower limb, it will cause intermittent claudication, rest pain, and gangrene. What is intermittent claudication? Intermittent claudication it is a condition that is characterized by pain and cramping that occurs in the leg, that occurs during the physical activity. And remember, it is relieved by rest. So the feature of intermittent claudication is that it occurs during physical activity and it is relieved by rest. So that typically occurs and it is caused by reduced blood supply to the legs. That so if there is reduced blood flow to the legs due to the narrowed or the blocked arteries, so that condition is peripheral artery disease. So in the heart, it can cause angina pectoris and myocardial infection, and in the brain, it can cause transient ischemic attack and hemiplegia. In the kidney, it can cause hypertension, and in the intestine, it can cause abdominal pain and infarction. Now, what are the types of arterial occlusion? It is the arterial occlusion can be of two types. One is the chronic arterial occlusion and other is the acute arterial occlusion. Now what is the etiology of chronic arterial occlusion? So remember, the most common cause, the most common and the main cause of chronic arterial occlusion is the atheroma. So the coronary and the cerebral vessels, they are most commonly affected. Now the two types of atheroma they may be seen. One is the yellow plaque in the tunica media. Remember the tunica media, it is the innermost layer of the artery wall and it is composed of single layer of endothelial cells, a basement membrane and thin layer of connective tissue. So when the fat material like the cholesterol and other lipids that would accumulate within the tunica intima, what there will you will see a yellow plaque. So yellow plaque, remember, it is a hallmark sign of atherosclerosis, in which a fatty deposit that is built up within the arteries that leads to formation of plaque. So this plaque would narrow or block the affected arteries, that would lead to reduced blood flow to the organs and the tissues that are supplied by the accumulation of fatty material within tunica intima. that can occur due to the genetic, diet, physical inactivity, smoking, or high blood pressure. The second is the accumulation of fatty material in the intima with additional fibrosis. This condition is more common and it is seen in middle and old age individuals. So you will see a lesion that consists of central mass of fatty yellow like material that consists mainly of cholesterol and it esters, and it is surrounded by a dense fibrous tissue that gives a white pearly appearance. So remember, cholesterol in the blood, it is not solely responsible but mainly the p lipoprotein that is mainly concerned in the formation of atheroma. The other cause is the Raynaud disease. What is Raynaud disease? It is a condition that will affect the blood vessels in the finger and toes that cause them to narrow and reduce the blood supply to the affected area. So, due to the reduced blood supply, what you will see? The episode of coldness, numbness, tingling, or pain in the affected fingers or nose that may be seen. There are two forms. One is primary Raynaud and other is secondary Raynaud. What is primary Raynaud? That occurs on its own, and secondary Raynaud is due to that it may be associated with other medical condition like the autoimmune disorder. If it is associated with autoimmune disorder, it is secondary Raynaud phenomena. The other condition is polyarthritis nodosa. It is an autoimmune disorder that affects the medium and small arteries in the blood. It can cause inflammation, damage and narrowing of the affected blood vessels that can lead to organ damage and dysfunction. So it is an abnormal immune response that will attack the lining of the blood vessels. It can occur in all ages, most common in middle-aged adults. So it can affect any organ, but it mainly affect skin, nerves, GIT and kidney. Other condition is giant cell arthritis. It is also known as temporal arthritis. What is other name of giant cell arthritis? Temporal arthritis. It affects the medium and large arteries, especially those in head and neck. It is seen over the age of 50 years. It occurs due to the abnormal immune response that causes inflammation of affected arteries. So similarly here there will be narrowing or blockage of arteries that could lead to tissue damage and reduced flow to the affected organs. So there can be headache, jaw pain, pain during chewing, fever, weight loss and fatigue, vision problems, double vision, loss of vision. The treatment here we can give high dose of steroids that reduce inflammation and prevent further damage to the affected arteries. Immunosuppressive drugs that can be combined with the corticosteroids. Now what are the local investigation we can do to detect the blood flow, to know the site of arterial occlusion? So one we can use is Doppler ultrasound. So it is a technique that will use the sound waves to produce images of the blood flow in the body. So there will be a change in frequency of sound waves that occurs when the source of wave is moving relative to observer. So when the sound waves encounter the moving blood cells, the frequency of the waves they get change, and that is detected by transducer. So the signal it is processed by computer to produce images of the blood. So it is a non-invasive and safe procedure and does not use any ionizing radiations. Other test we can use is the plethysmography. So what is plethysmography? So plethysmography is a medical test that measures the changes in the blood volume in the particular part of the body. So it is used to assess blood flow to extremities like the arms and the legs. What is segmental plethysmography? Suppose we want to evaluate the blood flow in the specific segment of extremity, like the upper or the lower leg, or upper or the lower leg. So here we will use the segmental platysmography. So the test involves the placement of pressure cuff around the segment and inflating it to occlude the blood flow. The cuff is then deflated and changes in the blood volume they are measured. So that will detect the changes in the light absorption. So this segmental platysmography can be used to detect arterial occlusion by measuring the changes in the blood flow before and after the occlusion. If there is a reduction in the blood flow, or you will see a delay in the recovery of the blood flow after the occlusion, that will indicate a blockage in the artery. Now, what are ways that you can use to manage the chronic arterial occlusion? You can use the conservative method. Conservative method like stoppage of smoking in the Burger disease. Diet should be well planned to reduce the weight. The diet should be planned to reduce the weight in the case of obese individual. As I said that P lipoprotein, they are most common abnormality found in the patient suffering from atherosclerosis, but we can use this cholestyramine that lowers the cholesterol level. Exercise can be done in that will reduce the pain of the patient with intermittent claudication. So you can treat diabetic and hypertension. Care of the feet should be done like in the case of Raynaud disease. The part should not be exposed to excess cold or the heat. So in the bed end of the head end of the bed, it is raised. That will, and the same time foot end is lowered. So that will increase the blood supply to the lower extremity. Use of analgesics can be given. Aspirin can be, as it is anti-adhesive effect of the platelets, we can use analgesic. Drugs, we can use antihypertensive drugs like beta blockers that may be used. Now the treatment you can do is sympathectomy. Sympathectomy, it is a surgical procedure. Here we do is the cutting or the disruption some of the nerves of the sympathetic nervous system. So sympathetic nervous system, it is the part of the autonomic nervous system that will control the involuntary functions like the blood pressure, heart rate and sweating. So sympathectomy, it is done to treat conditions that are related to excessive sympathetic nervous system activities like excessive sweating. The term we use is hyperhidrosis, or when there is abnormal narrowing of the blood vessels in response to cold or stress. The term is the Raynaud disease and chronic pain conditions. So what a surgeon do is they do cutting, clamping or destroying some of the sympathetic nerves depending upon the condition being treated. So it is a safe and effective treatment for the selective conditions. So the other procedure we can do is balloon transluminal angioplasty, or the term we use is balloon angioplasty. It is a medical procedure that is used to treat the narrowed or blocked blood vessels, particularly the artery. So here what we use is use of a special catheter that is inserted into the artery through a small incision into the skin. So as the catheter reaches the narrow or blocked area of the artery, a small balloon that is attached to catheter, it is inflated. So what the inflation will do? So the inflation of the balloon will compress the plaque against the artery wall. So that will widen the opening of the artery and hence improving the blood flow. So balloon is then deflated, removed from artery and catheter is taken out. So it is a minimal invasive procedure. So this can be done in the heart, legs, kidney, and the arms. What is Takayasu's arthritis? Takayasu's arthritis, it is a rare chronic inflammatory disease that will affect the large arteries in the body, particularly the aorta. So it is the main artery that carries blood from the heart to the rest of the body. So the condition is known as a pulseless disease, as it can lead to weak or absent pulses in the arms or the leg. It is an autoimmune disorder. That it means that the body's immune system mistakenly attacks its own tissue. So what are the symptoms? Patient may feel fatigue, muscle ache, joint pains, fever loss, fever, high blood pressure. So it will cause narrowing or blockage of the affected arteries, leading to reduced blood flow. So that can cause chest pain and shortness of breath, or fainting, or the stroke. What is subclavian vertebral disease? It is a medical condition that affects the blood vessels that supply in the neck that supply the blood to the arm, brain, and spinal cord. The subclavian artery, it is a large artery that originates from aorta and it supplies the blood to the arms, while the vertebral artery, it supplies blood to the brainstem and the cerebellum. So there are various types of subclavian vertebral disease like atherosclerosis, that is most common cause of subclavian vertebral disease. Thoracic outlet syndrome. So this occurs when the nerves and the blood vessels that passes through the narrow space between the collarbone and the first rib, they become known as thoracic outlet. It become compressed or pinched. So that is the term we use is thoracic outlet syndrome. What is anterior compartment syndrome? The anterior compartment syndrome, it is a condition that occurs when the muscles, blood vessels, and the nerves in the front compartment of the lower leg, they become compressed, and the pressure within the compartment, it increases. The anterior compartment, it is located on the front of the lower leg and contains 4 muscles responsible for the dorsiflexion of the foot and the ankle. So this condition is caused by acute injury such as direct blow to the lower leg or fracture. So the increased pressure within the compartment can lead to reduced blood flow to the muscles and the nerves. So that can cause pain and swelling and muscle weakness. So in severe cases, you can see the loss of sensation and muscle function.